In this episode about schedule optimization, you'll be examining the aftermath of the launch of Healthcare.gov and how it recovered from disaster. This third phase began on October 1st, 2013, day one of the ACA's first enrollment period, and ended just over a year later on November 15th, 2014, day one of the second enrollment period. Throughout those crucial first days after launch, CMS officials had to react immediately to multiple crises happening simultaneously. I asked Ruth Andoro from the HHS Inspector General's office about how CMS officials and outside contractors managed the situation in real time and worked through the crisis to get things under control.
They began immediately, 2, 3, 4 o'clock in the morning on October 1st to assess the situation and see where they were, and then pulled in additional people within the first week. And by a week out of October 1, certainly 2 weeks, the management of the project was completely different.
Karen Shields. Once Healthcare.gov went live, you had a 10-week timeline before the end of open enrollment. What techniques did you use in the days and weeks after launch to ensure that people could enroll?
There were people that needed to enroll, but there were also key pieces that had not yet been built. And so the leadership was very focused on making sure that we did not stop the momentum associated with continuing open enrollment and preparation for the next open enrollment. And so we split off into 2 parallel teams. One team worked on fixing the existing system to make sure that we could successfully complete open enrollment for the first year. And then the second team started working on transitioning in the new contractors and getting everyone ready to start to prioritize what was left to be built for Healthcare.gov. There was work that was not finished, and as we began to untangle some of the packages, there was also work that had to be redone.
2 weeks after launch, even with CMS officials and private contractors working around the clock, Healthcare.gov continued to flounder. Only 3 in 10 visitors were able to access the site, and a majority of those who did manage to log on were faced with slow-loading pages, error messages, and screens full of computer code that should not have been visible to users. As recovery efforts continued, the roster of engineering repairs would eventually grow to include more than 600 items. President Obama seriously considered shutting down Healthcare.gov and starting over. But on October 23rd, largely on the recommendation of a new team of advisors, he decided the project was salvageable. On what basis was their recommendation made? And what led them to determine that the site could be salvaged?
We had about 60% of the code that was considered to be ready for production. And so the salvage team, as it were, the red team, was including the feds who had already been working on the program, were actually analyzing that 60%.
Kurt Delvini, good to have you with us. You were appointed by President Obama to oversee the implementation and improvement of the Affordable Care Act website, Healthcare.gov, in December of 2013. Who contacted you about the job of senior advisor to the secretary, and what was that conversation like?
Well, it actually started at our kitchen table. My wife, who's a member of Congress, we were sitting down actually reading the New York Times content on the crash, and she said, well, would you be willing to help? And I said, sure. It seemed like a good fit with the skills that I had in terms of leading large project software development efforts. And so I found myself in the Oval Office with the president asking me to do the job, and I said, of course. The golden rules of software development weren't followed. There's only so many things that you can hold fixed. So you can have content of a software product, you can have quality, and you can have release schedule, but you can't have all 3.
When I was assigned to manage the repairs to Healthcare.gov, initially one of the things we focused on was how to get reliable data to see how the overall solution was performing. We realized that we needed improved dashboard capability, improved analytics, and without reliable data, it becomes really impossible to do anything but guesswork.
One of the very first things we had to do was build a very rich telemetry system that could tell us what's going on at any time. And we would stare at that throughout the day, over the weekends when we were getting to an end of an enrollment period. We would be looking at it all the time. We got to the point where it felt like a living, breathing thing. You could look at some of the metrics and you could see them tipping over before you saw any issue pop up in terms of the site itself.
This is where I think the real magic of the project came together. We focused on morning and evening scrums. We created a model where we could deliver improvements every weekend between Friday night and Sunday morning. We also had a rollback strategy so we could get back to our last healthy place. We also fostered an air of transparency for everybody so that the lowest level technician working on the project, if they saw that there was going to be a problem, they could raise their hand without fear of reprisal.
When you have teams that are not functioning at their ideal, then you need to focus them. You need to say, this is the most important. It's all hands on deck to get this done, and then this, and then this, and just work off the top of the list. The other thing that does is you start to get a rhythm building because you're all super focused. You can actually deliver on that. And you can feel good about the fact that you delivered on, for instance, claims adjudication, and you got that done. And that is the essence of Agile too. You're only working at the stuff that's on the top of the stack, but it's very much informed by what the overall business priorities are of what you're trying to accomplish.
Kurt, with all the essential repairs that were going on with Healthcare.gov during your tenure, let's talk about how communication changed among team members and stakeholders after October 1st. What were the most effective?
All the pieces were done by different systems integrators, and just bringing those guys together into a single place where they could diagnose problems in real time was absolutely critical. And so we had 24-hour-a-day war room where the system was being kept up and running. And at the beginning of it, they'd have a stand-up and they'd say, this is the order for the day, this is what we're doing, we need to fix this, etc. And so getting in that rhythm for the product team was really key. With Marilyn Tavner's team, we would have a multiple day a week status meeting where we'd get together, we'd have a clear set of things we needed to talk through, we'd make decisions, and we'd go off and execute those decisions.
On December 1st, Red Team leader and troubleshooter Jeffrey Zeitz issued a progress and performance report declaring to reporters that the site is now stable and operating at its intended capacity with greatly improved performance. I asked Ruth Andorel what made it possible to turn the site around relatively quickly.
They used more of a classic agile development method where they were learning throughout the process and doing assessments continually. And they suggested that people bring errors to their attention. And so in terms of scheduling, they did set that December 1 hard stop date as a day when they had promised the president and the public that things would be better. And so they were working toward that and had a very elaborate schedule at that point about where they needed to be.
Let's fast forward to April 1st of 2014. Officials from the stakeholder agencies met to plan for the second enrollment period, which would begin November 15th. This was a major change in communications methodology. They also emphasized ruthless prioritization and carried out a thorough assessment of personnel, time, and resources required for each task.
On that April 1st, 2014, they tried to do almost everything right that they had done wrong before. And so the first thing they did is hold a 3-day seminar where they pulled everybody together from across the organization who had some kind of responsibility. So everybody was at the table. If you recall my saying before that the divisions within CMS were working in a siloed fashion, this time they got everyone together, communications, IT, contract management, policy, and they made a list of all the things that needed to be done and then slashed that about in half, prioritizing only the things that were realistic.
Working together, both external Red teams and internal government teams have been working round the clock preparing for what came next. Karen Shields led those ruthless prioritization sessions from the government side of the shop.
The lock-in sessions were week-long, all-day events where we pulled each badgeless team by function into a room and we had them dump all of their desires and requirements onto a table. We ended up with a list of prioritized functionality yet to be developed, yet to be deployed, with t-shirt sizes and cost associated with them. That required our champions to say, Mr. President, there are some things that are required and are a part of the law in order for us to deliver the top 10 wonderful things that the public needs. These things below the line are not going to be delivered until a future date.
It all came together. CMS had established October 7th, 5 weeks before the start of the second open enrollment period, as a pens down deadline for all software development to be completed. CMS and their outside contractors made the deadline. On November 15th, the second open enrollment period began and Healthcare.gov opened for business again. In the first 24 hours, the federal marketplace handled over 650,000 unique visitors with the ability to handle up to 250,000 simultaneously. The website did not crash. By the end of the day, total enrollments exceeded 60,000, 10,000 times as many as on the opening day of the previous year. HHS and CMS made some enormous mistakes along the way, but more importantly, they learned from their mistakes. And we hope you have too. For the University of Southern California, I'm Taman Bradley.